He says his name is Ethan. He wanders the streets of Los Angeles, barefoot, disheveled, and bleeding. Ethan says he doesn't take antipsychotic medication. He's tortured by dark delusions.
I'm mentally ill and I don't receive the treatment I need out here. That's really the point.
Ethan is one of tens of thousands of mentally ill homeless people in this city. He's been arrested more times than he can remember, he says, and locked up here in the LA County Jail.
We've got prisons and county jails that serve as sort of de facto mental hospitals.
Author Steve Lopez has extensively researched the criminalization of mental illness.
LA County Jail has more than 3,000 inmates with a mental illness. So we prosecute rather than do the medicine that's necessary. We're more apt to punish than to provide the necessary treatment.
Until the 1960s and 70s, most mentally ill persons were confined in state-run mental hospitals. Advances in medication and concern over abuses in those hospitals led to many patients being released, and the asylums were shut down. But federal and state funding for a network of planned community care centers never materialized, leaving thousands of former patients homeless, untreated, and often in trouble. Jails were never meant to be treatment centers.
Most people who work in the jail system not only do they not understand mental illness, they don't know symptoms, they don't know behaviors, they have no clue as to how to de-escalate, nor was it designed that they should.
Advocates say what the mentally ill and homeless need more than anything is a place to live where they can get help and treatment. That, of course, would require taxpayers' money. But according to the National Alliance on Mental Illness, since 2009, funding for mental health by the states has actually been cut by more than $4 billion. Rob Reynolds, Al Jazeera, Los Angeles.